Diabetes is a leading cause of progressive morbidity and early mortality worldwide. Little is known about the burden of diabetes and pre-diabetes in Namibia. According to the World Bank collection of development indicators, diabetes prevalence percentage of population between the ages of 20 to 79 in Namibia was reported at 6.7% in 2021. Now, for more details, I'm joined by Hileni Samuel, a diabetes nurse educator under the Ministry of Health and Social Services. A very good evening to you, and thank you so much for being here.
Good evening, and also good evening to the viewers.
Now, what is diabetes and what kind of diabetes is commonly found in Namibia? Let's start there.
Yeah, let's start there. Yeah, diabetes actually is a metabolic disorder. It's a condition whereby we have higher levels of glucose into the blood, either due to the pancreas that is not really supplying enough insulin, or there is insufficient or there is no insulin at all to bring down these sugar levels down. And most of the time we have actually two types of diabetes that are common. We have other types as well, but the common ones is type 1 and type 2. And in type 1 is actually an autoimmune condition whereby actually the body actually view these beta cells is foreign to the body, and then it destroys these beta cells that are supposed actually to produce insulin to bring our sugar levels down. And it's actually mostly in the younger population from children until the ages of 35, is the type 1, and then there's no beta cells at all. There's no insulin coming in. That's why they are most of the time they are actually ending up on a injection. They cannot take tablets because it's the insulin that is defective. And then type 2 is actually a lifestyle condition where you have actually other causes, for instance, obesity, where we have sedentary lifestyle where people don't exercise, and then they pick up weight, and then that weight actually is the one that is now the fat around the pancreas, and then the insulin is not coming or is actually resistant. This is now the type 2. And it's, those are the two common ones that we have in Namibia. And then the prevalence really of diabetes, most of the people are undiagnosed. You can have diabetes, but you would not know about it because people don't go for screening, and also people don't feel, you don't really get signs that makes you to go to the hospital.
Now, before we get to the symptoms, I mean, you hear in certain homes where people are saying, don't eat too much sugar. So people tend to think that it's because people eat too much sugar that causes diabetes.
Not really.
Is that a myth?
No, it's a myth. Because as I said, when we have too much higher levels of sugar in your blood, it can be caused by, as I said, the pancreas that is not really producing enough insulin, or there is no insulin at all.
Right.
And also, as I said, like the type 2 is a lifestyle condition where we have pick up a lot of weight. And then remember that what we are eating, we eat is food, right?
Yes.
Carbohydrates. And then carbohydrates, 2 hours later, is turned actually into glucose.
Right.
And this glucose is energy. We need to use it. So if you don't use then the glucose, what happens? We pick up a lot of weight.
Right.
Yes, and also it can also be caused by other conditions, and also by some medication as well can also lead to people developing also diabetes.
Now, talk to us about some of the known symptoms that are experienced by patients.
Yeah, we have 3 classic ones where people are actually experiencing a lot of, they drink a lot of water. They are constantly thirsty. And when we are talking about water, we talk about liters. This person will drink a lot of, maybe more than 2 liters of water. And then they are always hungry, they eat a lot, and also they urinate a lot. Right. They urinate frequently, they will maybe wake up 2 to 3, probably 3 times in the night to go and urinate. And then also they are unexplained loss of weight. They just lose weight without being on any diet. Those are mostly the classic ones. And then you also have now the dizziness, they're tired, they are always exhausted, and then also blurred vision. These are also some of the signs that most of the people present actually to the clinics.
Now, earlier on, it was said that the prevalence percentage of population between the age of 20 to 79 in Namibia was reported at 6.7% in 2021. According to your statistics, at what rate is diabetic prevalence in the country?
Yes, a very, very good question. Currently, I think we stand at between 7 and 8%.
7 and 8.
Yeah, and then this percentage for a person out there, it might look small, but for our population, it's a big number.
Right.
And then diabetes is one of the non-communicable diseases that are also topping among the first top 10 conditions that are actually causing death in Namibia. As I said, most of the people, they are undiagnosed. And also the other issue is that when people go to the hospital, when they present, they don't really present with the signs. They present with a complication already from diabetes. And that's why we actually have to start to have a starting point on the prevention, because most of the people, when they go to the clinics, really, they are already having blurred vision, they already have peripheral arterial diseases, they've already maybe got a stroke, or they got a heart attack because of their sugars.
Now, it's very difficult to maintain a healthy lifestyle free of diabetes, obviously because of our different diets and because of lack of resources and so on. But how can it be done with a minimum resources that we have?
Yeah, very, very importantly, firstly, the person that is having diabetes is a self-management condition, and then topping up them with the medication. So they need to understand what is happening to their bodies,
right,
for them to be able then to manage them properly. With regard to diet, we will not really say there's a specific diet that they need, because we find somebody in the rural area, they have not access to what we are going to tell them. So we tell them to do moderate. They can eat what they have, but in moderation, and the portions are very, very important, as well as the calories that they take as well. Because we know that the carbohydrates, when you eat it as starch, we eat it as food, but 2 hours later, it's going to increase your sugar level. So they need to understand that. And there's something that I want to talk also very, very to emphasize on, especially people from the north, that they eat a lot of mahangu, all right? Mahangu is a very good starch, a very good starch, but if somebody is having sugar or diabetes per se, if they consume a lot of mahangu, because we know in our traditional, what we eat, our plate is a full plate, right? So if they eat that full plate, 2 hours later, their sugar is going to shoot up to 20.
Right.
And I've actually also witnessed it because I've done the regions, and I also experienced that when we teach, we say, okay, they can eat what they want to eat, test it 2 hours later to see what difference does it make. And we realize that once they ate that big plate of mahangu, 2 hours later, it shoots up. So we don't say that they must not eat. They must eat moderation, small portions of whatever they eat, whatever is available, but in small portions. The portions are very, very important, because all the other food stuff, they are also needed in the body, but in small portions.
And finally, what is your word of encouragement to those that are suffering from diabetes?
Yeah, as I said, diabetes is a self-management condition. I'm just encouraging as well the households. Firstly, when we go to buy food, when they are pushing that trolley, because there is a, let me say, there is this thing of people going to do shopping, but they have 2 trolleys.
Right.
One for the person with diabetes and one for the others that don't have diabetes. So I'm just encouraging them that it's costly to do that. And secondly, we want to teach also the children in the house to eat what the person with diabetes is eating, to create that healthy lifestyle, to create the healthy diets at home. That way, we're also going to reduce them and to prevent these young ones from getting the diabetes. Remember, this also run in the family, so the kids can also become diabetic one day. And also, if importantly, also in the management, people should actually adhere to their treatment. They should never miss their medication. And people that are on insulin, that are injecting themselves, it's also important to know that they need to understand when to inject and how to inject. Because if they are injecting and there's no food, their sugars are going to be low, and they're going to go into a coma or unconsciousness. So we want them to inject when they see the food is ready. When the food is there to eat, then they eat that time. And also to take care of themselves. To take care of themselves, visit the clinics. And when you also visit the clinics, you need to know also what questions to ask the health practitioners when you are visiting the hospitals and so. And also to adhere. Interestingly also that we picked up is drinking of juices and also fizzy drinks. All right? We find people who say, okay, no, it's a zero Coke or it's a zero whatever, is 100%. We are not worried about that. We are worried about the calories in that container or the calories in the whatever they are drinking. That is going to shoot their sugar up. So it's water. So the juices and the fizzy drinks is a no-go area. They should drink water. Because water is good. It's going to clean their kidneys. It's going to rehydrate their skin and so on. And also importantly, the complications. Complications are very, very important to note because people does not die from diabetes. They die from the complications. Right. They become blind if your sugar levels are not controlled. They get a stroke because of the sugar. The sugar damages your vessels. They lose their limbs because there is no blood flow to the limbs. Because of the sugar that is higher. They also lose their kidneys. They go into kidney failure because the sugar damages the vessels. And also the heart attacks is also prone. Those are the complications that can be prevented. And as I said, because most of the people, they visit the clinic while these complications are already there. And we don't want people to come to the clinics because of the complications they need to know. So also on that note, I would also like to announce that we are going to celebrate World Diabetes Day on the 14th of November. And we are also going to have free testing or free screening for diabetes from the 14th until the 16th of November. We are going to have different sites as well in Windhoek where people can go for testing. And this will also be announced next week when I come again for GMN to do that in detail.
Thank you so much,
right, thank you also.
Nurse Samuel, for coming and talking to us and demystifying diabetes to the public.
Thank you very much for having me as well.
Well, Hileni Samuel, Diabetes Nurse Educator under the Ministry of Health and Social Services, talking to us there about diabetes. Note the 14th of November, which will be the World Diabetes Day. Time now.